Once more, we say a very good welcome to you and thank you for joining us for this awareness. It's been on for some times, and I would like to start by saying there's a thin line between realism and pessimism, okay? And while some think that they are optimistic, I think they are simply not being realistic. And so sometimes I wonder, I know you don't do that, but sometimes I imagine losing my sight and imagine what will happen to me. And what does that do for me? It makes me take my eyesight very seriously. Recently, through this program, I've come to understand that one of the greatest gifts that God has given to us is the ability to see. And you don't want to imagine what those who probably were seeing before and have lost their sight are going through. You don't want to imagine that. Okay, but then you just need to be careful with your eyesight, and especially with this condition called glaucoma, because it does not present any sign until it has wreaked all the havoc it could. Richard Gabriel is my name, and good morning and welcome to another edition of Glaucoma on Radio here on Solid 100.9 FM Enugu, proudly brought to you in collaboration with the Eye Specialist Hospital Enugu. Today we are focusing on a silent but very dangerous eye condition that continues to cause irreversible blindness, especially in Africa, and it's called glaucoma. Our topic this morning is pressure, nerves, and vision, understanding the causes of glaucoma. And of course, to help us break this down in clear, practical, and relatable way, we're joined by a seasoned eye care professional and a glaucoma expert, someone who's not just doing a medical work, but who's doing a human's work because he's passionate about making sure that everybody's sight is intact. Dr. Obin Nashiwobi of the Eye Specialist Hospital Enugu. Good to have you.
Ndebai dalon ndewonu deje ka onabapela.
All right, Doctor, you're welcome
Good
to
morning.
Solid FM. Thank you so much. Thank you so much. Okay, so Doctor, for our listeners who may be hearing this term for the very first time, let's try to also define what exactly is glaucoma.
Okay, thank you, Uncle Isi. Okay, let's say in a layman's time, glaucoma is the commonest cause of irreversible blindness. When we say irreversible, it means that once the patient presents with visual impairment or inability to see, he cannot in this whole world do
Get
anything.
back what is lost.
It is only maybe divine restoration that it can come. But let's be practical and be in the truth ourselves. So it's the commonest cause of irreversible blindness worldwide. Commonest among the blacks. We keep trying to bring it up home. Commonest in West Africa than in other parts of Africa. Then in the Nigerian study, commonest among the Igbos. And then people have asked why, and we say this is in our gene. So I think the way to make our people realize that this is the commonest cause of irreversible blindness that is here with us. It's not something that is imported, but has always been with us. And that was why the Igbo man said, Ofuanya jisi ugwo. Because I believe they had this ailment in the years before now, in the years before medicine, before orthodox medicine came. We have always had medicine, but before the orthodox medicine came, and we had ideal investigations. So it's only appropriate to say that our forefathers knew there was a disease that will start with taking one eye, and after some time take the other one. With that phrase, Ofuanya jisi ugwo. But in these days, that Ofuanya does not owe blindness anything else, because once the patient gets visual impaired, he's alarmed and he comes down to us, and we're able to make this diagnosis and then counsel the patient and then stop the one that should, the one that has gone blind, we can't do anything except to keep the pressure normal so that it does not become painful, and then protect the one that is still seeing, so that at least all his life he uses that. But let me just say that by that time, that one is also visually impaired. You know, so it is only wise for our people to know that this disease is here with us. It's not trying to scare. We're not trying to scare our people, but you know, it's just like trying to say that cancer is here with us. You know, and that people should do their check their breasts, do their proper checkup, check their prostate antigen. You are not trying to scare people, but you're trying to tell them these diseases are here, and that the annoying thing is that if you are caught, you know, unawares, then you're in trouble. So that's why our people will advise everybody to have a checkup. Nobody is immune to any disease, and our people should realize this. Darling.
All right. Glaucoma has a nickname and is often described as the silent thief of sight. Why do they call it the silent thief of sight?
Yeah, okay, thank you. This is, this question answers almost all the questions that people ask today. You know, let me just say, give a practical example. If somebody kept ₦1 million in a cupboard, and then somebody comes to pick, you know, every morning he comes to pick 100 naira or 200 naira, 500 naira away every day. You know, over time, your eye will adjust to the mild reduction of the quantity of money there. If the person comes and then he picks 200,000 out, I mean, it's obvious now. That's but if the person does it gradually, every day he moves out 1,000 naira notes. So your eyes will also adjust to the decline of the height of the money. You know, so that's what happens with glaucoma. You know, it starts from the periphery. Now, most vision we use is the central vision. Even if somebody calls you from the side, you turn to look at the patient, or to look at the person. So the last vision to go is the central vision, which is the one we use almost always. Now, this impairment starts from the periphery. Now, if I'm looking at, if you're looking straight, you find that your vision still runs wide. You can see things by the side, despite the fact that you are focused on an object, you know, head on.
So now I could be losing the other ones.
Yes. So when you see that, you are unable to see that you are seeing your side, despite the fact that you are focused in front of you. It means that your visual field is still intact. Now, what people should do is the issue of trying to close one eye, look, close the other eyes and look, because when one eye is going down, the good one overlaps into the bad one. And because it overlaps, you wouldn't know that
makes it look like nothing is
going on, because you're actually using your two eyes. Now, if you try to cut off that binocular vision, now use one eye, cover an eye, the left, look with the right, then cover the right, look with the left. Then you notice that this is not, they're not the same. Then you know that there's a problem. I mean, people have come that way, that they never knew that this one eye has gone. They never knew. You know, so even yesterday I asked the woman, I said they never knew that one eye has gone. So because the other one was still covering for the other one, overlaps into the visual field of the other one. So I think, so this is why we call it the thief of eyesight, because it keeps stealing and you're unawares of the theft. You know, and as I said, somebody keeps taking 1,000 naira out of the cupboard every day. You will not come to recount the money. You will see, look at it and say,
it will look like nothing is
happening. You know, the day you say, something is wrong. This is not this is, you know, then by then 500,000 might have gone off, because you were also accommodating to the decline in the thickness of the money, you know, and then by the time you now realize that, let me do this, you know, let me recount, I think something is wrong somewhere. So that is actually what happens with glaucoma, you know, because our people, you see how things are now, people are all worked up trying to make an ends meet. The fact that they see that they're contented, you know, the fact that they're able to look at a distance and see, identify. Now they're not even aware that they have their peripheral vision is constricting, is narrowing, So, by the time they begin to complain, it means that the central vision is now getting affected. And as they now get alarmed, and they come and now say, this is advanced glaucoma. I said, advanced from when? When did the disease start? And now it's coming advanced. Because he did not do the appropriate thing he should have done. When we say annual checkup, these diseases are picked up by the ophthalmologist earlier before you will even know that you have an issue. So we plead with people, what does it take you to have an annual checkup? And like you asked, Uncle Isi, in our discussions, you've not realized the importance of seeing, and our people say, you tend to undervalue what is important until you lose it. So we plead with our people to do the needful and know that this is a thief of eyesight. A thief does not spare, So we keep appealing to our people to do the needful. Thank you.
All right. And we also pray that you don't need to lose it before you can begin to appreciate it. I appreciate my sight so much, and I can't even imagine living without it. Yes. Okay, our topic today mentions pressure. What kind of pressure are we talking about, and how does eye pressure damage vision?
Okay, thank you, Uncle Isi. Just like you have the blood pressure, which circulates around the body, the eyes also have the intraocular pressure, which maintains the globe the way it is. Like football is maintained with air. Now the eye is also maintained with fluids, one anteriorly, one posteriorly. Now we're talking about the one anteriorly. This is what keeps the eye the way it is. If not, if you remove it, the eye will just shrink, and then there will be collapse of the entire content of the eye. So there's a proper balance of production of the aqueous humor, which is the fluid we're talking about, and drainage. So the eye produces it, and it is drained. Before that time, it nourishes part of the eyes. It also removes waste. It also has antibiotics in it, so that it keeps the eye sterile and safe. So there's this proper balance God has given us. So there's a proper balance in production, and there's also balance in drainage. Now, if anything affects either, then there's a problem, especially if the drainage is now affected by any factor, that the drainage is no longer adequate. So there's normal production of aqueous, there's reduced drainage. This will only increase intraocular pressure. Now, if there is so much production and then drainage is the way it is, then it will also increase the pressure. So these are the factors. Once this pressure, in this balance, the eye tissues are maintained, including the optic nerve, which is the nerve of vision. Now, peradventure, anything happens and these pressures increase beyond what the eye seems to be physiological, it affects because this nerve of vision, the optic nerve, is actually the nerve that transmits information to brain for interpretation. Okay. So if it is not there, the eyes are open, light rays are entering the eyes, but it cannot be conducted to the occipital part of the brain, and therefore the brain does not interpret anything because there's nothing to interpret. So once there's this imbalance and the pressure is raised, it affects the retinal ganglion cells, which are the cells of vision. They're on the optic nerve. The nerve fibers too are also affected, and it can create what we call oxidative stress, which destroys these retinal ganglion cells, which are maintained when the eye intraocular pressure is normal. Now, for these very increased intraocular pressure, it affects the functioning of the tissues of the eye, especially the optic nerve. And the optic nerve bears the brunt of increased intraocular pressure. And that's why we say nobody will tell you you have glaucoma. You wouldn't even know you have intraocular pressure, except you come and it's measured. By the time you know you have raised intraocular pressure, that means it's causing headaches, or it's actually affecting your vision, and that this imbalance, once this imbalance exists, it affects every part, even the cornea, may become hazy and become edematous, and therefore vision drops. But more importantly, even if when the pressure comes down, the corneal clarity returns and it's no longer hazy, the retinal ganglion cells, because these are part and parcel of the brain, they're offshoot of the brain, and brain cells don't recover when they die. That's why we have that we say it is irreversible. Once dead. So we say because of this increased intraocular pressure, which affects the optic nerve, it destroys the retinal ganglion cells, the RGCs, affects the nerve fibers, and then affects vision, because this is the nerve of vision. If the constituent parts that make it functional are destroyed, obviously its function will become impaired, or affected, and then this will always lead to impaired vision. And if left uncontrolled, if there's no intervention, it progresses from visual impairment to blindness, and we can't recover it when the patient is blind. So that's why we say this may happen within a short time, depending on the pressure, and what is causing this increased pressure. If they are not attended to immediately, we may have a situation where we can't be able to recover anything. But if seen on time, and the person is mindful of his vision, that the vision is impaired and there's a discomfort, and that his vision is not seen as he used to see, and then runs to the hospital, yes, we can save something. So this is how it works. Raised intraocular pressure affects the nerve of vision, which is optic nerve, and also affects other structures of the eye. I mentioned the cornea, and also the eye. Every part of the eye is affected, but most importantly is that nerve of vision, that offshoot of the brain that conducts light impulses to the occipital part of the brain for interpretation, for us to say we have seen. So if it is affected because the pressures are raised beyond the physiological the physiological way the eye functions, it means that everything in the eye will be affected. And like we said, the key factor here is the optic nerve, which may not recover even when the pressure is brought to normal.
Okay, talking about pressure, let me see whether I understood all you were saying. Sometimes doctors speak in their own language, and okay, so there are two issues I heard you say. Production, the production,
drainage,
good, and drainage. So if there is much production and there's no drainage, it could raise the pressure, right?
Yes, sir.
And then if there's no enough production, it could also raise the pressure, right?
Well, no, if there's not enough production, most times the key thing here is the drainage.
Okay.
That's why we bring up the issue of aging.
Okay.
As one ages, the angles narrow.
Okay.
And then with trauma, it can also affect the drainage angle.
Okay.
Now with inflammation, cells, macrophages can also plug the trabecular meshwork that allows for drainage of the angle. So when you have cataracts and it is unattended to, it pushes forward, it also narrows the drainage angle. So, and that's why in some cases you have a normal angle, but like I said, macrophages, tissues can actually plug those drainage angle, and once they're plugged, pressure rises. So many times there's a normal production, I think the issue most times is the drainage. And then if the drainage, you know how a gutter is not well, I mean, there's no, how will I put it? The gutter is not cleared, you know. They obviously, when it rains, it comes up on the road because these are clogged, you know. And then if there are pipes, and these pipes have debris, and they have pure water things in there clogging this, obviously the pipe may burst, you know. So all I'm about to say is that once that drainage angle is affected, and then drainage of the aqueous is inadequate, the pressure of the eye will rise. So
Okay.
and this is, most of the drugs are geared towards, you know, reducing production, and but more importantly, increasing outflow, increasing drainage of this aqueous.
Okay, it might be necessary to look at what could be the main causes of glaucoma. Is it hereditary, lifestyle related, or both?
Okay, multifactorial.
Okay.
You know, multifactorial. We've learned is, yes, genetics accepted, it runs in family lines, but let me say that everybody is prone to glaucoma. You know, the glaucoma can be primary without any cause, or it can be secondary, you know, like trauma, like abuse of steroids, you know. Then it can be open angle, that is, the angles are open, but maybe somehow they are plugged, you know, or the angles are narrow, which is obvious because it's narrow, the pressures are high. So multifactorial. Now we said the black race, the Hispanics, the Asians are more prone, but the blacks have more of the prevalence of both the disease and its complications. We also say that, I mean, we have also known that people have myopia, very severe myopia. You know, those ones have open angle glaucomas. Can also affect it. Those who have short-sightedness, those who are also long-sighted, can also have glaucoma from narrow angle, because many a time it is because the eyeballs are not as big or as normal as should be, so the angles are narrow. Now we not talked about aging. We said earlier that as one ages, the angles narrow, commoner in women than men. Now we have also known that the cornea, what we see as the black of the eye, you know, if it's thin, not thick, they are more prone to glaucomas. We've also known that hypertension, diabetes, migraine, cardiovascular affections of the can also cause, you know, increase the risk of glaucoma. You know, so this we've known. Now we've also known that trauma, these are secondary causes, you know, can also cause glaucoma. Abuse of steroids can also cause glaucoma. Now there are also disease conditions that can also cause glaucoma. So it is multifactorial, you know. And when we look at the patient, we're looking at beyond just the patient is a black person. No, we are trying to see, can we find out the cause of this? And you know, common among people who are above 40 years, commoner in people who are 60 years and above. And as you age, the more likelihood of glaucoma, you know, comes. Now, we also talked about things like uveitis that affects the eyes, you know, can also cause glaucoma. So, like I said, it is multifactorial.
Okay.
You know, the most important thing is that once the person comes to the hospital, we not only make this diagnosis, but we're looking at for other things that can affect this vision. You know, we know the commonest is raised intraocular pressure, but there are people who seemingly have normal pressures, but also have glaucoma, which means there are other factors that are affecting that causes this glaucoma beyond raised intraocular pressure.
Okay, the loss of vision from glaucoma, is it gradual or could it be sudden?
Okay, thank you. It could be both, but in the primary glaucomas, it is a gradual process. So,
without even the person knowing.
Without the person knowing, and that is what we said earlier, the thief of eyesight. Gradual causes of disease tend to get the person more than things that come sudden. Now, glaucoma can cause both, but the primary glaucomas cause painless, progressive diminution of vision. Now, for the angle, this is actually for the open angle type. For some of the closed angle type, they can cause pain. Now, the other inflammatory causes can also cause pain. And as painful diminution of vision. But commonly, it is a painless diminution of vision that starts from the peripheral vision and narrows to the center. And that's why we said, because the last vision to go is the central vision, and that's what we use mostly as humans. People will not realize that their visual field is constricting, and by the time they know, it is already late. So we say, before glaucoma blindness comes, glaucoma has been there for years, and that people should do the needful. Thank you.
All right. Are there lifestyle habits
Yes.
that could help me maintain normal eye pressure?
Yes. I think we took this up at the time. Talked about exercise. Talked about what we eat. Talked about exercise, that you shouldn't let your body be above your head. Talked about aerobic exercises, and then talked about lifestyle changes
For those about position of sleep.
Yeah, position of sleep, and then even drinking water. How to take water in gulps than in the sips than trying to take one jerrycan at a time. So we also talked about we talked about sleep. We talked about even there's the issue of green vegetables, what we eat, and I think it's all about then smoking. We talked about smoking. We talked about very strong alcohols. The ekpeteshi, the ogogoro. That is not the beverage alcohol, not the stout that people take, or those ones are called beverage alcohol. No, we're talking about the real raw alcohol. So we also ask people to avoid these things. Now, we've talked about not well processed cassava. And then I know, yes, are people tend not to like that one because of the love for abacha. Yes, we accept, but we've just said to ourselves, in a bid to meet up with demands, and the more you're able to meet up with the demands, the more money you get. And then people tend to shorten the fermentation process that helps remove the cyanide content of this cassava. And we've known that cyanide causes optic toxicity, optic nerve toxicity. So we appeal to our people, even for those who even not only the cassava, even the apple, even all the products that come from the cassava. So we talked about people about process, that fermentation process should be observed. The protocol should be observed, and then it shouldn't be shortened, because you want to meet up with demands. So these are life style changes, but very importantly, annual checkup is also a lifestyle change. People should know that. I do not see, and I keep saying it, as somebody who has a car, keeps maintaining his car, but has never maintained himself. And then when anything happens, you begin to blame forces beyond you. So we also want to say that our people should, for those who have a family history of blindness, of visual impairment, should come. For those who have myopia, because it's associated, is also a risk factor for glaucoma, should also have their eyes checked, dilated fundoscopy. Now, for those who you are aware that a grandfather or a grandmother, even a grand uncle or a grand aunt, when blind before death, you should also come and avail yourself opportunity. But having said all this, you don't need any of these histories. All you need is the fact that you are human, that you should have an annual checkup. So we plead with our people. It is only appropriate.
Okay. We'll be going for a short break any moment from now on, but let's treat. It appears that those who believe that by not presenting themselves and by ignorantly believing that everything is all right, that they could just wish away what is real. And you said that sometimes is there years before it is presented. Okay, so
yes, yes, correct.
Yeah, let's look at some of the myths that I don't know where we got it. Incidentally, Africa is steeped in superstition, which mixes with religion to produce a very dangerous concoction. Okay, so instead of simply doing the right thing we're supposed to do, there are those who believe that they are enriching the doctor by taking care of their eyes. Okay. Yes, there are those who believe that.
But it's true. You talked about the myths. I don't know. You really talked about religion and what are people.
Superstition.
Yes, superstition.
When it makes sense, it's terrible.
And then somebody comes to the hospital and tells me, Doctor, I heard that you don't operate on glaucoma. And I am asking, who told you about this? Who told you about that you don't operate on it? And I keep saying, whoever says he can't operate on glaucoma is actually a quack.
The last time I was at the hospital, I saw a man who was operated on one eye.
Yes, so then the myth that it affects the elderly only. it is common among the elderly. It can affect even a child born today can have glaucoma. So our people should know this. It can affect young people. Young people are coming down with blindness. Yesterday at the clinic, and I asked the resident what happened to this patient. He said, it's a non-glaucoma patient whose eye just burst. It was just laughable, but I said, okay, what happened? So it happens to be that he's been having glaucoma and never took it serious. And then by the time he came, obviously he had lost both eyes. So, and I asked myself, why do people wait this long? And then the other people believe he could use what do you call it again? That's somebody said there are leaves that we can pluck. See, we know that prior to orthodox medicine, that our people had their own medicine, their herbal medicine. But in this time, we want to do things that are scientific, things that can be proven.
Yeah.
Now, if those are leaves can be proven, to God be the glory. Please, we should bring them forth. So we want our people to realize this. So we only do what we know works. So secondly is the issue of somebody says my vision is good, I don't have glaucoma. That is not true. It's only the doctor that can say you do not have glaucoma. The fact that you see, you may still have glaucoma. Now the other one, that glaucoma can be cured. It has been proven beyond all reasonable doubt that it is treatable but not curable, and therefore we cannot cure glaucoma. For now, just like you cannot cure hypertension as per you give a drug and it goes. No, it is treatable. You're on treatment for life. Same thing with glaucoma, except we operate. Same thing with diabetes. So these are chronic diseases. They are timed chronic diseases. So the other one is that high pressure is the only factor. No. While high pressure is a major risk factor, you know, it can occur in people with normal pressures, you know, and because other factors like genetics, diabetes, injury also play a role. Now, somebody says it is not in my family. My grandfathers, both maternal and paternal, my grandmothers all had no issue. But you know, people forgot that diseases can jump a generation. You know, so and then because everybody can have glaucoma, you can't say because your grandparents, your parents, even your great grandparents did not have it, and therefore you will not have it. No, there's nothing like that. Anybody can have glaucoma. So our people should realize this. So, and then the issue of people who use computer and says it can cause glaucoma. Computer does not cause glaucoma. You know, watching television does not cause glaucoma. You know, and then applying an eye pencil does not cause glaucoma. You know, so but all we're trying to say is that our people should realize that these myths do not have scientific basis and therefore cannot stand. You know, we want our people to realize that this disease, if you are waiting for symptom, then you are most pitiable of people, in the sense that we've said is a thief of eyesight and that the symptoms come late. You know, so it's only a doctor who sees you annually that can say, your eye is suspicious, or your eye, you have glaucoma. In that way, you beat it. You're able to catch it on time. And then for people that are caught on time, the likelihood of going blindness is very remote, because we saw them quite on time, and therefore they can be managed very well. Now, for people who come when it's late, when the disease has laid foundation, has taken toll on your vision, you know, it is obvious that it is difficult to manage such people. So, still goes back to this whole thing that the people should do the needful, have their eyes checked regularly. By regularly, I say, okay, annually. You know, you take it every year, and the doctor says your eyes are good, you don't have, you go home, come back next year, you know, until God calls you, you know. So, having said these things, our people should realize that, please, before you begin to attach religious belief or superstition to a disease, just do the needful first, and then you'll be well guided.
All right, the talk lines are open at 0704 550 2840, 0909 771 1009. You've got to learn, you've got to ask questions, and you've got to get clarifications. Whether you have it or you do not, be inquisitive and try to find out, you know, some of the things that could help you. If you know someone else who has it, you can also call. We have less than 20 minutes to go, so the earlier the better. 0704 550 2840. Hello, good morning.
Yeah, Uncle Yossi, good morning.
Hello.
Thank you. Can you hear me?
Yeah, Claire.
Yeah, say good morning. And thank you for bringing this awareness to us every now and then in various areas. God will continue to bless you, and this will be your bigger year.
Thank you.
Happy New Year to you.
Thank you.
I want to ask, please. You said we are going to check our eyes once in a year.
Yes, sir.
Are there signs that we should have for us to know that this thing is coming, or do we just keep on checking every year until the end of the day? And secondly, I'm having this problem. Whenever there's something, that is, when I wake up, I won't be able to. I will have a blurry vision, and when I bring my phone close to see something, I won't until I keep it, a bit far from me. Then I'll begin to see. So I don't know how is that a sign of glaucoma, and then what are we supposed to be eating to improve our eyesight? Thank you.
Okay, you heard him.
That's the Chief of Geography. He didn't mention his name to us.
I can't remember his name.
Okay, thank you so much for your question. First is that you don't need any symptom to have an annual checkup. But yes, what are things that could be telltale signs? If you begin to find out that your vision is now cloudy, and then if you begin to bump into objects, things that you've seen before, you're now bumping into them, and then you find out that you're unable to, things that you could identify from a distance, you're no longer able to identify them. So these are or like I said, you try doing what I asked you to do. Close one eye, look, close the other one eye, look, and then there's disparity between the two. Please come. And then what you said about waking up and looking at your phone or a paper or a write-up. Oh yes, it happens. You need to adjust. That's what we call light to dark adaptation. That's what we call dark to light adaptation. You are waking up and you are taking a script to read. You have to adjust a little. And then for your age, once you get to age of 40 and above, you may need spectacles to read. So for such people, keep your glasses close to your phone or to what, maybe the Bible or what you want to read in the morning, so that you wake up, you can actually take a walk out and then ease yourself and come back. Then your eyes should be able to have adjusted to reading or to looking at things, because you just woke up from sleep. And when you are doing that, the pupils dilate. When you open your eyes, they tend to constrict, and then it has to constrict to the appropriate level for you to have a clear image or clear picture of what you're looking at. Now we've talked about fruits and vegetables, both the colored fruits and vegetables of all types. So this is what I advise our people. And then the issue of exercise. These are highly medicinal. Thank you.
Okay, the talk lines are still open. 0909 771 1009, 0704 550 2840, 0704 550 2840. I'll also like you to speak concerning these. There are people who will tell you person never chop you. They talk of going for, and people are not used to. People don't even go for general medical checkup, and so they are not even. They don't even think about their eyes until it's bad. So, what do you say to people like that?
Yeah, thank you, Klisi. It's also that lifestyle change. This is a new year. Our people should do things properly. We know things are not economically good, but there are things that are basic. It shows the premium you put on your life. If you have value for your life, if you know that if anything happens to you now, your children will suffer, then you should do the needful. What will be most painful is if you go blind from what is preventable. And it is established that 75% of blindness in sub-Saharan Africa are avoidable. They are just avoidable. And Nigeria being part of sub-Saharan Africa. So for somebody to go blind, there are things I don't want to say here, because you see people going blind because you are asked to do this requires surgery. And we've tried drugs and drugs did not work. And then you are told the only way out is that we should do surgery. And somebody's, is told the cost of surgery and he runs away. And then if the person dies, the burial alone will be 10 times the cost of that surgery.
They don't think eye problems can kill.
No, so it's already established. Scientifically established that once a person goes blind, lifespan drops. It is established. There are no two ways about it. No, look at literatures. Once a person goes blind, lifespan drops. So the same person who said, I don't, this is too costly, but you'll be able to spend that same money for something else. You could decide to throw a party because you're happy, and then you spend 10 times that same amount. You are complaining that why would he spend this amount just because he wants to have a checkup? And I say it is the premium you put on your life. That is what it shows. Now, if you value your life, if you value the responsibilities you have, even if you don't love yourself, at least you should love your family, and then ensure that your families are taken care of. And for you to do that, you also ensure that this your body should be well looked after.
Taken care of. All right, we have a few more minutes. So if you're going to make a call, now is the time. Let's take this one. Hello, good morning.
Yeah, sorry, Uncle Lucy. I forgot to mention my name. It's Kells.
Go ahead.
Yep.
Thank you.
Hello?
I think he just called to mention his name. Where I asked you his name earlier.
Okay.
Yeah. So, so going back. Okay. So let us say to our people,
let's take this call. Hello.
Okay.
Good morning.
Hello? You see, good morning, sir.
Good morning.
This is Mark from Anambra State.
Mark, you're welcome. Go ahead.
Just a quick one, please. I want to ask. Taking routine drugs like yeast tablet and cod leaf oil, what effect does it have to the eye? And can it also be used to combat anything called glaucoma? Thank you.
Okay, thank you. Mark, okay, I'm happy you asked this question, I want to use the appropriate adage, there are diseases that are not preventable. Now it's good to use yeast. Yeast helps, but it will play more role for people who are malnourished. Okay. Now, cod liver oil, yes, it gives you omega-3 fatty acids, and helps in the vitamin A production. Beautiful. They are okay. This can be taken as supplements, but when we say use the word supplement, it is like somebody who doesn't have enough, you're trying to supplement. Now, but if you go by what we've agreed, the fact that you are doing appropriate exercise, the fact that you are eating and you're eating well, balanced diet, you're eating enough fruits, you're taking enough vegetables. When you are doing these things, you are having the yeast, what we used to give you, what the cod liver use. These are good on their own. But if you are going to have glaucoma, it will not prevent it.
Okay.
Now, for those who have hypertension, it will not prevent it. All I'm about to say is that it's good to have these lifestyle changes, to be positive, to have eat well, eat enough fruits, vegetables, and then do exercise. Do the much you can do to be in good health of body, mind, and soul. But it is also appropriate that you should also have these organs of your body checked. The eyes, the liver, the prostate, the breast, these tissues checked. It is only appropriate that you should do the needful. Now that you are taking yeast will not stop you from having a cancerous growth. Okay. You're taking this, it does not mean that you not have glaucoma. Like we say, these are lifestyle changes. They are supportive. Okay. They are not actually therapeutic in the east sense or stopping a disease condition coming on, but they are helpful.
Let me quickly take this one. I don't know why it's coming late. Hello, good morning.
Sorry, I want to know, please, can doctor tell us how much it could cost? He's been talking about having a check. What, can we have an idea of what the cost of having a check is?
Thank you, my brother. Thank you so much.
Just a check. Okay.
Just quickly. A check. A check could be as cheap as 2,000 naira annually to say 30,000 naira annually. For the government hospitals that have well-read, well-established consultants, as little as 2,000 naira, you've done your checkup. Yes, in the private hospitals it is costlier, but it does not. None will exceed 20,000 naira. Or let's say, yes, it does. That's I mean, would that stop you from having your eyes checked? If you don't want to go to the government hospital, you can go to the private hospital. If you don't want to go to the private hospital, you can come to the government hospital. So there are places you can go to and have your eyes checked. But very importantly, ensure that you see an ophthalmologist. That's a medical doctor trained to look at your eyes and evaluate it appropriately. So I want to say, don't put costs when it comes to life. Don't put costs. Like I said, 2,000 naira. Is that why you shouldn't have it done annually? And then even if you are charged 15,000 because this is a private hospital that must exist, that must be sustained, it's only appropriate that we should do what is necessary.
All right. Thank you, Dr. Obinna. You've done a very good job. And those who are listening, I hope you take it very seriously to avoid, had I known. There are those who are visually impaired today who used to see. And my friend in Ngwo will tell you that there were signs. I mean, yeah, but then he took it for granted. And now his children are also reluctant about presenting themselves for test. Let's do the needful. We might just be able to take care of certain things rather than relying totally on God and not taking human responsibility. Thank you, Dr. Obinna, for this intervention.
Yes, thank you so much. Let me just say one thing. People say something must kill a man. But it would be stupid if that thing that kills a man is a preventable thing. It will be very annoying that thing that kills that man is something that could have been prevented. It means, I don't know what to say, but it's just not what our people are known for. Something must kill a man, accepted. But they will let the man die at his appropriate time without being cut down by conditions that could have been prevented. Thank you.